Pneumonia. Pneumonia is an inflammatory condition of the lung affecting primarily the microscopic air sacs known as alveoli. It is usually caused by infection with viruses or bacteria, and less commonly other microorganisms, certain drugs, and other conditions such as autoimmune disease. Signs and symptoms. People with infectious pneumonia often have a productive cough, fever accompanied by shaking, chills, shortness of breath, sharp or stabbing chest pain during deep breaths, and an increased respiratory rate. In the elderly, confusion may be the most prominent sign. The typical signs and symptoms in children under 5 are fever, cough, and fast or difficult breathing. Cause. Pneumonia is due to infections caused primarily by bacteria or viruses, and less commonly by fungi and parasites. Although there are more than 100 strains of infection agents identified, only a few are responsible for the majority of the cases. Mixed infections with both viruses and bacteria may occur in up to 45% of infections in children and 15% of the infection in adults. A causative agent may not be isolated in approximately half of the cases despite careful testing. Diagnosis. Pneumonia is typically diagnosed based on a combination of physical signs and a chest X-ray. However, the underlying cause can be difficult to confirm as there is no definite test able to distinguish between bacterial and non-bacterial origin. In general, in adults, investigations are not needed in mild cases. There is very low risk of pneumonia if all vital signs and auscultation are normal. In persons requiring hospitalization, pulse oximetry, chest radiography, and blood tests, including a complete blood count, serum electrolytes, seroactive protein level, and possibly liver function tests are recommended. Classification. Pneumonitis refers to lung inflammation. Pneumonia refers to pneumonitis, usually due to infection but sometimes non-infection, that has the additional features of pulmonary consolidation. Pneumonia is most commonly classified by where or how it was acquired: community-acquired, aspiration, healthcare associated, hospital-acquired, and ventilator-associated pneumonia. It may also be classified by the area of lung affected: lobar pneumonia, bronchial pneumonia, and acute interstitial pneumonia, or by the causative organisms. Differential diagnosis. Several diseases can present with similar signs and symptoms to pneumonia, such as chronic obstructive pulmonary disease, asthma, pulmonary edema, bronchiectasia, lung cancer, and pulmonary embolism. Unlike pneumonia, asthma and COPD typically present with wheezing. Pulmonary edema presents with an abnormal electrocardiogram. Cancer and bronchiectasis present with a cough of longer duration, and pulmonary embolism presents with acute onset sharp chest pain and shortness of breath. Prevention. Prevention includes vaccination, environmental measures, and appropriate treatment of other health problems. It is believed that if appropriate preventive measures were instituted globally, mortality among children could be reduced by 400,000, and if proper treatment were universally available, childhood deaths could be increased by another 600,000. Management. Oral antibiotics, rest, simple analgesics, and fluids usually suffice for complete resolution. However, those with other medical conditions, the elderly, or those with significant trouble breathing may require more advanced care. If the symptoms worsen, the pneumonia does not improve with home treatment, or complications occur, hospitalization may be required. Prognosis. With treatment, most types of bacterial pneumonia will stabilize in 3 or 6 days. It often takes a few weeks before most symptoms resolve. X-ray findings typically clear within 4 weeks, and mortality is low. In the elderly or people who have other lung problems, recovery may take more than 12 weeks. Epidemiology. Pneumonia is a common illness affecting approximately 450 million people a year and occurring in all parts of the world. It is a major cause of death among all age groups, resulting in 4 million deaths yearly.